And then, you know, we would hit this probably going through the calf money spot, but like, if you come down here, Leo, and look at how much muscle I'm actually bypassing, like you see how much skin is on top up here, that's what I'm not having to go through to hit this. Like, for me to get to this depth that I am now, I'd have to push through a hell of a lot of painful stuff that Ninja probably doesn't really want to go through, so. G'day everyone, Aaron and Ninja here. I am releasing a series. Ninja just had a go at me for stealing one of his obscure anatomy series, so I'm running with Aaron's slightly obscure anatomy series. We're talking about a muscle that I've wanted to do a video on for ages, and it's basically the muscle that flexes the big toe, but the fancy name is flexor hallucis longus. And so our little colouring chart here, so we've got to take away the gastrocs and the soleus, and we go to the deeper muscles within the calf. And we're looking at eye here. What colour is that, Leo? I'm so colourblind. Is it purple?
Purple, yeah.
Purple?
Yeah.
And what's that one? Is that green?
Teal.
Teal, shit, my nightmare. So the purple one is the big toe flexor. So what I love about it is it actually starts on the outside of the calf, so the fibula, and then it wraps around the inside of the ankle and then obviously into the big toe to help with, flexing the big toe like that, but also plantar flexion as well. So all the things we need to move, walk, run, jump as a human really well. But why I think it's kind of forgotten about and doesn't get enough treatment is I feel like if you've injured your ankle, if you've injured your Achilles, I feel like this muscle, if it doesn't get treated, can actually be the one last handbrake or block that's stopping you from regaining that function of your foot and feeling like you've got a bit of power. All right, so we're trying to stimulate that purple one there, mainly in the muscle there. We can do some tendon work as it comes into the foot, but what I want to show you here is is a really cool chart. This is basically where it attaches. So the outside bone there is the fibula. So that's the outside bone on the lower leg. You've got the tibia, which is the inside one. The fibula is the skinnier one on the outside. So it starts right along the fibula here, basically wraps around to the inside and then down into the big toe. So it's kind of cool how you got this muscle that interacts with the big toe that's actually on the outside of the leg up here. So we're going to show you how to treat it. So I guess for this one, it's just having the awareness that it's not the gastrocs and the soleus. And so, sorry for interrupting your video, guys, but I want to talk to you about the MMT Online Academy. So you might have been looking at Ninja and I doing our stuff for a long time now, thinking, how good would it be to work at MMT? But you might be overseas. This is your chance to get exclusive content, updates from us every single day to make you a better practitioner, more new customers, better results, and skyrocket your income. So if you want to be on the inner sanctum, get into the Academy. All you got to do is dedicate 5 minutes a day to making yourself better, and it's just 28 bucks per month. How good's that? $7 a week. Let's go! You don't really want to go through, even though you can go through those bigger structures to affect it, I feel like it's better off if you just bypass them. So you want to get those ones out of the way. See that little flick there that I did? So that's that gastroc soleus. And we know that the fibula is the bone on the outside there. So if we bypass all those muscles by pushing them away, and then we pin down onto the fibula, and then we ask Ninja, how you feeling, mate?
Yeah, good. Yeah. I'm just tuning into it. I'm just trying. Oh yeah, I can feel the big toe. There's a spot, just in the instep a bit.
So when you flex your big toe, you can actually feel this kind of working up here. Yeah, that's cool.
Yeah, I'm getting a sensation I don't normally feel. Right down into the big toe as well.
That's really cool. So Ninja's already doing the dynamic work, which is awesome, and that's what we encourage our customers to tune into what's going on, be intuitive. If they feel like they want to actually move their body to create like an active release, we really encourage it. So I guess for me, what I'm trying to feel is that I'm pushing down onto the fibula, because from that chart you know that muscle attaches to the fibula. So if I'm pinning it down and I've bypassed the gastrocs and the soleus, I know I'm on it. And then the fact that Ninja doubled up by saying, I can feel that kind of going into my instep when I move my big toe. We know we're on it. So, I feel like, say when you sprain your ankle, that classic sprain where you roll the leg like that, a really important part about getting that person back to function is teaching them how to use the instep again and actually be, because when you roll it like that, you see how that mechanism of the injury, you're kind of avoiding this, okay? So really re-establishing that, being able to load through the midfoot and then push off the ball of the big toe is really important. But if this is all locked up in here, it's actually going to stop your ability to flex the big toe and use it. So that's why I feel like with treatment, yeah, we're going to treat the calf, we're going to treat the ankle, but maybe you're not hitting this as plumb as you should, and that's robbing that person of gains. So we might just work our way down. So once again, remember we're bypassing the soleus and the gastrocs and then pinning straight down onto the fibula. Seeing what Ninja's got in there. So when you're starting out this treatment, you can maybe do a little bit of pin and release. Push it aside and then pin down. Just to get a gauge on the areas that are the biggest concern for your customer. Because sometimes they might have it further up where I started, and then sometimes they might be a little bit lower. But for Ninja, I feel like, I don't know what you're feeling there, man. I feel like higher up you had a little bit more.
Yeah, no, still some
Still
there,
good
man.
there?
Yeah, that is. So I have actually had an injury many years ago, but this has been my troublesome leg.
Really?
So it's the ankle, the knee, but the calf I've been feeling a bit. So just there's tender.
Yeah, so it's right on the fibula there. So that's where knowing your anatomy is really good, because I know that it attaches to that fibula. I know if I pin the fibula, I'm hitting that muscle a little bit. So yeah, it's important to have your muscle chart handy, and even talking to your customer about this kind of stuff and actually show them on the chart, get them involved in your treatment. I feel like that's a really good way to build rapport and just get them to tune in and make it an active process, because it's not a do it to me process. Do you know what I mean? As much as we're doing the therapy on their body, we want them involved in the process, especially if we give them tasking and we give them homework to do. We want them invested in the process. So a little bit higher. Let's see what. How's that, Ninja?
Yeah, feels good.
Feels good. Yeah, I can really feel when Ninja moves his big toe. Like if you come over here, Leo, again, we'll just show him again. When Ninja moves the big toe. And what's cool is he's just trying to move the big toe, because there's actually a different muscle that flexes the other 4 toes. So with Ninja just doing that big toe, I can really feel that muscle popping up. So it's really cool. I wonder if it's a bit higher as well. Like if I get right up, push that aside and pin down. Much up there, Ninja?
Yeah, it's a bit.
What's it feel like? Comparing to the normal calf money spot that we do through soleus and gastroc?
It's sort of just fairly, not that intense like the money spot, but what I'm really noticing is when I move my big toe, I can just, feels like this strange referral into the big toe just before.
Cool.
Yeah.
So reckon this might be one you needed for a long time?
Yeah, it's been overlooked or hasn't been hit. So anatomy does come in handy, mate.
That's it, man.
I'm learning.
And then, we would hit this probably going through the calf money spot, but like if you come down here, Leo, and look at how much muscle I'm actually bypassing, like you see how much skin is on top up here. That's what I'm not having to go through to hit this. Like for me to get to this depth that I am now, I'd have to push through a hell of a lot of painful stuff that Ninja probably doesn't really want to go through. So
it's all right.
Yeah, cool. There's some good work in there. So the other part of this too is actually coming to the other side here, Leo, as well. And I guess having that understanding that the tendon, that's more where the belly of the muscle is, but the tendon would come and run somewhere on this instep here as you come down into the foot. So I'm just going to start on the ankle there, and then I'll get Ninja to flex the big toe again to see if I can feel. Yeah, can you just do the big toe, Ninja? That's good, man. I can feel something underneath my pressure popping up again.
Yeah.
Anything there, Ninja?
Yeah, there's a little bit in there. Feels like the ankle kind of stuff.
Ankle sensation, yeah.
Yeah. In that ankle money spot, it's kind of related to it.
Yeah, so you can do a heap of comprehensive work through here as well. And just having that understanding, if I grab that hook again, like if you look where I am, I'm just around the instep there. So you can see how it does get quite, not ligamenty, quite thin. And it's just like a tendon, a really long tendon. And you see it goes all the way down into the big toe. So I might just grab some wax and we'll just do a big strip down the big toe. Just put a little bit of wax on there. I'm just going to get on the bloody table here an inch.
Oh.
There we go. So remember, these are very deep. So I've got to push through the plantar fascia and other structures to actually hit that tendon. So you've just got to sink into it. So I've hooked in. I'm not moving yet because I want to sink into that depth where the tendon actually is. And then I'll slowly start to trace my way down. Keeping in mind, there's always like a real good nugget right about here that people have.
Yeah.
Feels like a hard, it almost feels like a bone. And like there is bone there, but that hard little ball I feel like is just soft tissue. So we want to work it.
Yeah.
So you can see I'm just slowly making my way down. Giving him a fair bit of curry.
It's all right. Oh.
He's doing good.
It's nervy down there, isn't it?
Yeah. Yeah, when you get towards the... Good catch, Leo. When you get down towards the ball, the big toe, it does get quite sharp and nervy. Try and get over that callus there. I've got a little bit of wax on the plough, but I'm just making my way over it. I've got a bit of a snag there. I'll just shimmy along a little bit and then get into that big toe. Really finish the job there, just hook into that.
It's a little money spot.
Mobilise that a little bit. Maybe get him to do a little shimmy there for me. Yeah, look at that. And then done. Pull out of there. So that's a pretty sped up version of how we would treat that. So yeah, do all your kind of mid-belly work by pushing away from the bigger muscles, but never forget the tendon. A lot of people would probably do a lot of work up here, but then neglect the work into the foot. And just see if the people that are suffering from some foot issues after an ankle sprain or a broken foot, Achilles problems, see if that can help bring that foot back to life by treating a muscle that you might be avoiding. So yeah, done.
Slightly obscure anatomy.
Slightly obscure anatomy. We've got all bases covered, eh, Nin?
We do.
Thanks, guys.
Done.